name's Danielle,
I'm Kaidra. I'm a physical therapist here at CC's.
and today we're talking about pelvic floor 101, weak versus tight. Everybody asks this question.
Mm-hmm.
So how do you know if your pelvic floor is weak, tight, normal? How do you know? What do you do?
Yeah, usually we just look at the symptoms,
Mm-hmm.
and if the pelvic floor is weak versus tight versus whatever, it doesn't necessarily matter unless you're having symptoms that affect your quality of life. Otherwise, there's no sense in going like, what do I have? Usually the symptoms that arise are pain,
Okay.
gas, leakage, and other dysfunction elsewhere. So sometimes it's like abdominal pain, bloating, other things like that.
Perfect.
Yeah.
All right. So all those things can go awry, but how do you know where it is? How do you activate it? What are some things you can do?
Yeah, so with treatment wise, we usually work outside in. So we look at the
Okay.
full body, like the core, not
Mhm.
just from the front, but the back, your hips, because all those muscles connect into your pelvis and it
Okay.
affects like the pressure.
Okay.
And your pelvic floor is essentially like a pressure management.
Mhm.
And the symptoms only ever occur with some dysfunction where the pressure isn't able to be maintained.
Okay.
And then that's why you have the leakage or pain or whatever it may be.
Okay.
So then with treatment, we go from helping that dysfunction and then we load it.
Okay.
And a lot of times, like, do you start with a Kegel? I usually almost never do a Kegel with my patients.
You don't. You
Mm-mm.
don't. So you don't recommend Kegels for patients.
I think there's more than
Okay.
what a Kegel gives you.
Okay.
So I may do an assessment, and with internal assessments we can do, but those are actually not every pelvic floor patient that I see, only if they don't get improvement from treating outside in.
Okay.
But then I may assess, like, can you do a contraction?
Mm-hmm.
And a lot of times it's, can you get out of a contraction, where a lot of people are too tight.
Gotcha.
And they're just maintaining a Kegel always.
Okay.
So yeah, I almost never prescribe them.
Interesting.
Mm-hmm.
So, and you talked about loading. So, what do
Mm-hmm.
you mean with that? Like, how are we loading
Yeah,
pelvic floor? That sounds kind of weird to me.
it is. You kind of have to think of it like you have to build the bike,
Yep.
right? So you have to be able to maintain relaxation. So I usually start with like breathing,
Okay.
and then pelvic mobility.
Okay.
And then you add a core contraction with breath work.
Okay.
And then from there, it's like, let's get a barbell on your back.
Gotcha.
And if you can tolerate that, then that weight of purposely loading it is more difficult than like a cough or a sneeze. That usually is what leads to some pelvic dysfunction.
Interesting. So you can actually put weight to doing pelvic floor exercises.
Correct.
Crazy.
You should like train it harder than what you do in your daily life. And a lot of times it's like, well, I have to lift the laundry basket one time, and usually that's when I have some leakage. Or whenever I'm sick, I feel all of the symptoms, or during intimacy is when I have some pain.
Okay.
But you got to think of like, when do you purposely move your pelvic floor, or think about your pelvic floor,
Right.
or coordinate that. And so like, that's our job, is to get people to understand that.
Okay.
And understanding it is about 80% of the treatment.
Wow. So there's a lot more than just a Kegel that you can do for exercise. And so even personally, I've heard like doctors recommend like you should really work on your pelvic floor, and you should do like Kegel exercises and do those kinds of things. But I didn't know that there was more.
Right.
There's more.
That's what we're here for.
That's perfect. And then tell me a little bit about yourself too. So what do you like to treat physical therapy for pelvic floor?
I really like treating the pregnant mama, postpartum mama, and then the active athlete that has some incontinence or pain with movements, or the person that's just getting into movements that's like, I don't really know what I'm doing.
Right.
Like, oh, let me tell you.
Perfect. And how long have you been treating pelvic floor?
Oh gosh, I think it's been 3 years.
Oh, wow.
And I kind of fell into it. I didn't go looking to treat the pelvic floor at any point in time, but it was just kind of a missing component. And I remember at one point April was like, "Kid, you're going to start treating my patients." And I was like, okay. But then it opened my eyes. I was like, gosh, so many people need pelvic floor therapy. It's just so undertreated, and a lot of times it comes out as back pain or hip weakness or whatever it may be.
Yeah.
But yeah, it's just so important. It's our foundation.
Right. Absolutely.
Right?
Absolutely.
Yeah.
And you talk about everybody needing to do pelvic floor stuff. So in looping back around to Kegels and that kind of thing too, is there anything that men can do for like strengthening pelvic floor?
Very similar. So it's all like pressure management system, like a can of Coke.
Okay.
Right? If it's got a dent in it or whatever, if it's open from the top, your pressure changes. So, but if you can maintain the pressure, that can of Coke is pretty durable.
Right.
Right.
Okay.
And so no different. It's just a matter of relaxation on what's tight and create some awareness and coordination. A lot of people have horrible coordination of the hips and pelvic floor.
Right.
And just understanding what it's supposed to do.
Yep.
And then you just load it.
Wow.
Yeah.
This is crazy.
It's
I'm learning
easy.
So much.
Yeah. Come on in.
Yeah. And then I think we're going to go through a couple movements and things like that too, just to kind of show everybody like what else you can do besides doing a Kegel, which is apparently a lot, which is great.
Pretty much anything.
I love it. And then we again will be doing another core conversation next month. We're going to be talking about bladder myths and healthy habits. So going over a little bit about the all that good stuff. Yeah. So
you bet.
Perfect. Okay, let's go through some of those movements.
Okay, let's start with the dead bug. Okay. I'm going to have you lay on your back with your head up that way.
Perfect.
I'm going to come around the back side. Okay, we're going to do pelvic tilts first, actually.
Perfect.
Because that's going to help you with your dead bug.
Okay.
So the pelvis can move forward and backwards.
Okay.
And that's what we're going to try and find right away.
Gotcha.
Okay, so you have your back against the floor. I want you to try to smush your back fully against the floor and then make space as if my hand were going to come up underneath it using your pelvis. Nice. And now smush my hand, make your back flat, and then come away from it. Yep, and if you put your hands on your hips, like you're a little sassy, you're going to rock them backwards, and forwards.
Oh,
you
interesting.
Got it.
Okay.
And it's a slight movement. Like when you first learn it, you're going to recruit a lot of muscles like your legs, your butt, some of your chest is going to help move too. But then as you fine tune it, you're going to be able to isolate it to just your pelvis.
Just the pelvis. Okay. So when you're doing this movement, you don't want like your whole body to move. You just want your pelvis to move.
Yeah, but it's not a whole body crunch.
It's just a
nice, easy, slight movement of your pelvis.
Gotcha.
Okay. Now what I want you to do, we're going to add on to this. Okay. So when we treat the pelvic floor, it's kind of layers. We just add some layers onto the cake. So you're going to do a pelvic tilt and make your back flush against the floor.
Okay.
You're going to maintain that. I'll have you reach your arms up, grab onto this band, straighten your arms here, and I want you to pull down and tuck your ribs down and keep your back flat against the floor.
And hold this?
And hold. But now don't hold your breath.
I was holding my breath.
I want you to breathe in and out as you're maintaining this. Don't let your back arch away from the floor.
Interesting.
Yeah.
I can definitely feel like the loading that we were talking about earlier, how it feels like there's more like it's more muscle into it instead of just the pelvic floor.
And when you're holding your breath, your pelvic floor isn't able to maintain much more of a load.
Okay.
Right? Yeah. So if you can give it breath movement, your diaphragm moves and it creates some relaxation of your pelvic floor.
Yep.
So that way it's still working. It's not just like a Valsalva, you're holding your breath and there's a ton of pressure. You have to be able to take and give some of that pressure.
Gotcha.
Okay?
Perfect.
You probably feel a little fatigue into here. So you
as
can
I
come
hold
on
it a
out
little
of
bit
that.
more,
Good job.
Perfect. So then with this, do you want to move it like
so
this?
You can. Okay. I start with an isometric, which means you just hold it stationary.
Okay.
And then from there, you come down and into it.
Oh, wow.
So that way you can...
I can feel my back like wanting to come up when I pull down.
You have to really engage a lot more when you add in like arm and leg movement.
Yes.
Or you could hold this and maintain that. Don't move it. And then lift a knee, march it. and then switch
Oh,
into
no.
your other one where your back really wants to come up.
Right.
But it's a matter of like maintaining your core, your foundation, your pelvis. And then when it comes to like loading it with like a barbell, you know where your body's supposed to be in space.
Right. Yeah, I feel like I'm definitely working more instead of just doing like a Kegel.
Right. Like if you just came in here and you did like a crunch, you wouldn't even be thinking about your pelvic floor. But when it comes to adding in all these little steps, it's great. Plus, if you do a Kegel of your pelvic floor, it's only the bowl of your pelvic floor muscles that are working. Where here, you're recruiting a ton around it. So it's so much stronger.
It's a lot more. Yeah. Perfect. Beautiful. What's next?
Let's do a back squat.
Perfect.
Go ahead and come on up underneath the barbell. Have it on your shoulders, not your neck.
Perfect.
Okay, then I'll have you go feet about shoulder width apart, your toes out slightly, and then you're going to do a pelvic tilt for me. So I want you to go all the way forward and all the way back, and then find a neutral. Find your middle between the two.
Perfect.
Okay? Then we're going to use your breath as you do your squat. So you're going to breathe in, either at the top or as you're going down.
Oh, okay.
And then exhale out. Wow. Yeah. Go again. Inhale, exhale. And the big thing here is when you keep your neutral, when you go down, you're not wanting to like flare your ribs and stick your butt back, and then you have a ton of back pressure. Okay. It's a very common thing to see. And then you come up and there's a ton of pressure in your pelvic floor, and that's where people will tend to leak. Okay. But if you can exhale as you're coming up, you're recruiting your core. Like if somebody were to punch you in the gut, you would, right? So you gain all of this for strength to get you out of it, and some momentum there too. Gotcha. Okay. Perfect. Right. Exhale out. Good. All right. That's all there is to it. Then you just slowly add weight. Yeah. And then you can add difficulty. You can do other exercises, deadlift, overhead press, anything where your limbs are having to move and this is having to maintain. Perfect. Neutral. Beautiful. All right. So you talk about all these different weights and like these different lifts and things that you can do too. How can people implement weightlifting and Kegels at the same time? Like, do you guys run classes like that here? Perfect. So we've created programs for people for this reason and others as well, to be preventative. Okay. So, I mean, like we want to treat patients, but we also we don't want people to be injured constantly. So we have some classes, Strength Foundations, which runs as a 6-week class. It goes Tuesdays and Thursdays at 6:30 in the morning. Okay. For an hour, and you learn a back squat, a deadlift, overhead press, most all of the barbells, and then we add in other things there. But the big thing is you progress over time, and you increase your load, and then you learn how to deload. So when you're done, you can take that and run with it, and however you want to train on your own afterwards, you know how to build a program. Perfect. Then we also do Monday, Wednesday, Friday. We call them lift labs. Okay. Upper body, lower body, and core, and they're all provided by a PT. They're small group classes, and we just get you in here and we help you work out, and we make sure that like what you're doing isn't gonna create pain. We look at your form. We're there to motivate you and guide you through every step of the way. Perfect. And all of those lifts would be beneficial for pelvic health stuff. Yes. Men, women, everybody. Got it. Perfect. You just got to load it. Beautiful. Beautiful. Perfect. Well, that's it for us on this episode. Like I said earlier, join us next time, and we'll see you around. Nice job.